Hello everyone, welcome to Dr. To China and in this video we are going to talk about the basic orthodontic terminologies. Right, so let's get started. Like you can see, these are all the clinical pictures. This is a normal bite. We should know what is a normal bite so we can understand what is overbite and overjet and deep bite and open bite and cross bite and underbite, or we can also say it reverse overjet. So let's know about what is normal bite. Normally, the incisor edges contact the lingual surface of the upper incisor at or above the cingulum. You can see clearly in this picture that the lower incisors are contacting the lingual surface of the upper incisors. They may contact at the cingulum or maybe above the cingulum. Next is overbite. So in overbite, it is the vertical overlap of the incisors. Okay, it is overbite. You can see in this picture, and let me just draw so you can see. Okay, so I am just highlighting, marking with the red marker that is this is the overbite, and you can see that it is the vertical overlap of the incisors. Okay, and there is a value. It is a normal overbite, like it's 2 to 3 mm, and the if it the overbite the value is more than 3 mm, then it is the deep bite, it is called, or maybe increased overbite. And if it is less than 2 mm, then it is reduced overbite. You can see this clinical picture. Next is overjet. As you can see in this picture, overjet, it is the horizontal overlap. Okay, not the vertical overlap is overbite, and horizontal overlap of the incisors is overjet. So in this picture, animated picture, you can see that this one is overjet because it is a vertical overlap. Okay, no, sorry, it is a horizontal overlap. Look, horizontal. And if it is the vertical overlap, then this is the overbite. So next is if the also the value of overjet is 2 to 3 mm, and if it is more than 3 mm, it is increased overjet. And if it is 2 less than 2 mm, overlap is less than 2 mm, horizontal overlap, then it is reduced overjet. Okay, so next is deep bite. So the overbite. So deep bite, first we will talk about definition. A condition of excessive overbite. We know what is the normal value of overbite. It is 2 to 3 mm, and if it is more than 3 mm, then this is deep bite, where vertical measurement between maxillary and mandibular incisor margins is excessive. When mandible is brought into habitual or centric occlusion, and there is a clinical picture you can see, like it may be normal, maybe severe, or maybe moderate. So normal is 3, if it is 3 to 5 mm, then it is normal, and if it is 5 to 7 mm, then it is moderate, and if it is more than 7 mm, then it is severe, deep bite. Okay, next is underbite or reverse overjet. So we have already known that what is overbite, overjet, and they have their types also. So like that we know what is overjet. So reverse overjet is their relation is to the like horizontal overlap, not the vertical. Okay, if there is a malocclusion, that there is a vertical measurement, it is too excessive, then it is like we know about deep bite, but it is a reverse overjet. So reverse overjet is the normal front teeth are positioned in front of the upper teeth. You can see this in class 3 malocclusion. In this picture you can see the lower incisors are positioned in front of the or lower teeth. We can say that the lower front teeth are placed in front of the upper front teeth. So next is what is open bite. So open bite is a malocclusion where the top teeth and bottom teeth do not come together in bite. Okay, this means there is no overlap of the upper and lower teeth, front teeth, and thus leading them to looking open. You can see in this picture there is no overlap of the front teeth of the lower and upper incisors, no contact, and thus leading to them looking open. Next is classification of open bite, and it is according to Moyer 1988. He classified open bite into skeletal open bite associated with jaws and dental open bite associated with dentition. So skeletal open bite can be anterior and can be posterior. Posterior may be unilateral or can be bilateral, and dental open bite can be class 1, class 2, and class 3 malocclusion. Next is cross bite. So definition according to Graber. Crossbite is a condition where one or more teeth is abnormally malposed, can be buccally, lingually, or labially with reference to opposing teeth. Next is classification of crossbite. It can according to position, and one is according to origin. So according to position is that is can be anterior crossbite. It is a single tooth. You can see in this picture that single tooth. This is the anterior crossbite. Then single tooth is involved. Next is posterior crossbite and can be bilateral and unilateral. But in this picture you can see this is a posterior crossbite and is unilateral. Next is according to origin, dental crossbite associated to dentition, skeletal crossbite associated with skeletal structure, jaws, functional crossbite associated or due to mandibular shift on closure leading to crossbite.